The pleasure to meet today. I am Dr. Abboud. I'm an endocrinologist. I'm board certified in endocrinology, which is the hormone and the metabolism. I'm board certified in internal medicine and board certified in obesity medicine. So we opened this center because we saw that there is something we need to do. We were running a campaign, lifting the weight of the nation. We are spending so much money on sick care. We don't have something called health care. So we wanted to change this, one patient at a time. So I decided to do this evening session to make people aware of all the hormones and what kind of role they play in our body. And you will be surprised, 99% of the people who are struggling with their weight, they either have hormonal issues or metabolism issues. So what are hormones? Imagine Wall Street when the internet is not working. That's how our body will be when our hormones is not in balance. This is what hormones remind me of, and that's why I get into the field of hormones, because hormones are very, very important. The body is consistent of millions of cells, and how do they communicate with each other? Via hormones. There is no internet in the body, but hormones are the internet of the body. So our body with messed up hormones exactly looking like that, or looking like that. A traffic jam with the signal is not working, or looking like all this airplane trying to get in and the tower is not working. Literally, that's how hormones to our body. So define the word hormones. It came from a Greek word which means excite or arouse. And it is the chemical messengers taking the message in between the cells all day long. And they regulate the metabolic function in our body, and they communicate with each other to give us the best of ourselves. There are so many hormones. When I say hormones, most people think menopause, testosterone. There's way more than that. So the endocrine system is very complicated. We do have a top gland, it's called the hypothalamus, which is in charge of all the glands. And the second in demand is the pituitary gland, which is the second master gland. And then we have the adrenal gland. Many of you hear about adrenal fatigue. Many of you hear about Cushing. So those are all related to that. And then we have the ovaries and the testes, and then we have other endocrine system, thyroid, parathyroid, pancreas. And guess what? There is the most important one, which we did not talk about for the longest time because we didn't know what it was until recently, which the weight loss hormones. However, let me just show you how the pituitary is in charge of all the glands in the body. And then we always have to think about how the glands communicating with each other. So the pituitary gland take all these messages and disperse it to the rest of the gland. We will be covering few important ones today, but usually the center is in the hypothalamus, which secretes so many hormones, send messages to the thyroid, send message to the testes, to the ovaries, and make us living in balance. So the adrenal gland, many of you don't know where it is actually, because we don't hear about things until there's a problem with it. It's a small pyramid gland sitting on the top of the kidney, and they do cause problem. Every time we come across one of our patients who's not able to lose weight, we think about adrenal gland and we test them for that. You will be surprised how many of them they do have problem with that. So again, it's pretty much, you don't know about hormones until they're not working. But it's a good idea to make sure all your hormones are in balance before they get into the imbalanced situation. And then I'm not going to talk a little bit today much about the ovaries and the testes. That will be Robin, who's the nurse practitioner, who has a lot of experience with the hormonal replacement for men and women in regard using bioidentical hormones, which is a natural product. We will move into the testosterone and the estrogen, and most people think testosterone is a male hormone, but in reality it's very important for both male and female, and Robin will shed some light on that. The pancreas is another important gland, and many of you don't even know about what's going on in the pancreas, but when you come to see us, one of the things I order all the time, something called C-peptide. C-peptide is reflecting for us how hard your pancreas is working to keep your body in shape and not turning into diabetic. I can tell you, half of my patients, I test them for the C-peptide, they have a C-peptide high, telling me how hard their pancreas is working to keep their body in a good condition. The hypothalamus and the pituitary gland, again, it's in the middle of the brain, and we don't know much about it until we have an issue with it, which is one of them is the pituitary tumors, and the other one is interruption in all the pituitary hormones versus like the thyroid and the adrenal and testes and the ovaries. So what caused the imbalance? When you have persistent weight gain, belly fat, low libido, fatigue, anxiety, insomnia, digestive problem, food craving. I'm not gonna ask you, but I guarantee you, everybody has at least one of those symptoms. So that means your hormones are in trouble and there is some kind of imbalance. So my job, which I love, finding the missing pieces of the puzzle. And you will be surprised how rewarding is that. And then I always try to test for more than one thing, never like to put all my eggs in one basket. And it's very, very rewarding. Think about you're doing this puzzle pieces and this one piece which is making the whole picture looks weird. If you cannot put that piece in the right place, the picture will never look right. And that's how treating hormones and finding the missing piece so important. I'm gonna talk a little bit about thyroid first, because many of us struggle with thyroid disease, and then every time I get somebody comes to me and they said, oh, you know what, they tested my thyroid and it's just fine. So there are more specific tests to the thyroid than this regular test which everybody does. Better late than never. No, it's okay. We're just getting started, like a few minutes, and we'll get you in the back soon. So the thyroid gland is the small butterfly sitting in the front of our neck, right under Adam's apple. And it is responsible for so many important things in the body. And just regular test, they call it TISH, which is TSH, does not reflect your thyroid. It is okay for most people, but it's not okay for many others. So what does the thyroid gland do? Thyroid gland regulates the basal metabolic rate. So when we talk about metabolic rate, what does that mean? You will see this all the time. You and your friend eat the same things. You gain weight, your friend doesn't. You and your sister eat the same things. You gain, she doesn't. So this is the metabolic rate. So some people can burn food much faster, some people can't. And that's why the thyroid is very, very important, because it regulates the metabolic rate. Also, it supports the red blood cell, it supports all the bodybuilding parts, and it maintains the electrolyte balance, and it maintains the temperature. You would be surprised how many people, they will come to me and they will say like, my feet are always cold. And no matter what I do, my feet are always cold. So the thyroid is one of the hormones regulate the temperature in our body. So again, when your doctor say, I tested your thyroid and I did your TISH, it's TSH, and it's normal, it doesn't mean anything. We always have to look further for the thyroid, because there is a lot of things going on in the thyroid gland. So the hypothalamus and the pituitary gland and the thyroid in communication with each other, and they are responsible for the metabolic rate, for the growth, for the temperature, and you cannot order one test without the other. So it's almost like taking a screenshot versus taking a video of what's going on. And again, it's very important, and never take, no, you don't have a thyroid problem if you are still thinking you might have a thyroid problem. And so going back to this TISH, TISH is not a thyroid test, it's a pituitary test. And that goes to the thyroid gland and tell the thyroid gland to give us our thyroid hormone, which is T4 and T3. And those are the main hormone we test beside the TISH. And it's the relationship between those hormones what is important, and that's how we decide if people have or don't have thyroid issue. And again, pituitary, thyroid, all those hormones are important. And sometimes we order the hypothalamus hormones called TRH, but we rarely do that. When we do TSH, free T3, free T4, it is sufficient. And we usually have to replace T4 and T3. And many of you are familiar with a thyroid hormone called synthroid, levothyroxine, but there's more to the story. There's another hormone called cytomel. Sometimes we cannot utilize our own cytomel, our own T3, we have to replace that. I'm gonna move on into obesity. So obesity is very, very common, unfortunately. And we spend so much of our health resources on obesity. And like the thing is, it is a serious condition. And I always tell my patient that's the only disease have its own board. There is a board certification in obesity because it's a very complex disease. And when I started practicing, and I would get patients who has weight problem, and they would say, I've been going to my primary care, and they would just tell me, zip your mouth. Every time I hear this, it makes me so angry. And then it just like, I wish I could just find out who's that doctor and just give them a course of obesity, but I'm not gonna. So how do we decide what is obesity? So obesity, we take the patient's height and the patient's weight. And so that's a relative thing. So theoretically, they said in order for you to call somebody obese, their body mass index has to be more than 29.9. And they're overweight more than 25. But this is not what I look at it. And then all the medical society, the American Medical Association, the World Health Organization, the American Association of Clinical Endocrinologists, and the Obesity Society, they all decide like, yeah, it's a very serious disease. Let's treat people when their body mass index more than 30. And then they went back, so think about somebody who's aging, and most of them, like, they're underweight. So when they reach the body mass index of 30, they are much, much far advanced in regard to the disease. So to me, it's a relative thing. So I have a lot of people, they weigh like 110 pounds, and then she will tell me like, you know what, I am at this weight and I'm not comfortable with it. I used to be 95. So this extra 15 pounds carried significant effect on her body. So it's really a relative thing. Looking at the exclusive number is not a good idea. So we have to individualize how we look at people's weight. And then I just want to show you how common it is in the United States. And we get our share actually in Illinois. So I don't think I'm going to leave Illinois. Sorry, I'm not going to Arizona, but like there. So the incidence of obesity in the dark blue and the light blue is very, very high, between 30 and to 35. And then at least half of the United States in the overweight status. And then this is the definition. Again, they keep saying, you know what, that doesn't apply for everybody. Asian people, the body mass index, if it is 25, that is obese. Well, actually, to me, any body mass index depends on the patients where their comfort zone is. Some people, like, they weigh normal, their body mass index is 25, which consider normal, but they don't feel good. They've been, their body mass index been 22 all their life. So when they are 25, that is too much for them. And I will treat them for what their comfort zone is, not what is the reality. So another thing we look at is the waist to hip ratio. It's not only the weight. So for men, it's different than for women. And usually it helps me by looking at people to decide if they do have this metabolic syndrome or not. Again, like, the obesity is so common. I mean, if you go shopping and you will look at people, more than half of them are overweight. I mean, it is very serious disease. It causes hypertension, it causes diabetes, heart disease, some cancer, depression, arthritis, breathing problem, asthma, and there's nothing it does not cause. And depression and obesity, they overlap. It's very unfortunate that a lot of symptoms of depression could be symptoms of obesity and vice versa. So it's very, very important to try to address all those issues. Now I'm going to talk about what we didn't know for many, many years. So what are the weight loss hormones? So we knew that weight is very complicated. We know, like, we don't eat when we're hungry. We eat for the wrong reasons. So you know how many people will tell you, like, I used to feel this way until I get more educated on this. Like every time I'm working a long day, I'm exhausted, I go home around 10 o'clock, like I'm so tired, and then I start eating, and I'm not even hungry. I interpret the fatigue by hunger. When I am stressed, I interpret the stress emotion by hunger. So those are all the wrong stimulus to eat. And because we are missing some of these hormones. So there are so many hormones involved in the weight. There's hormone called ghrelin that increase food intake. There's hormone called PYY that decrease the gastric mobility. And more importantly, there's a hormone called the glucagon-like peptide. Glucagon-like peptide in the right corner is one of the main hormones we were able to extract and use it to our benefit. And we are able to use this as a tool to treat patients, and we restore why are we eating. We are eating for the right reason when we have enough of this hormone. We're not eating for the wrong stimulus, but we're eating for this hormone when we're hungry, when we are replacing this hormone. There's few more hormones, and then a lot of studies on this, and they are in process of identifying them and using them as a pharmacological tool to treat obesity. Going back to this two hormone, the GLP-1, which is many of you familiar with some of the products, it's made in the form of Wegovy and Ozempic. And there's another hormone called GIP. The combination of GIP and GLP has been made in a medicine called Mounjaro. And this is where this hormone works, because we are supposed to eat for hunger, but we are missing this hormone. We eat for pleasure, and we crave a lot of food, and we don't eat enough to our slow metabolic rate. We eat enough until there's not food in front of us. I call it the seafood diet. Every time I tell somebody, hi, you are on seafood diet, I don't even eat seafood. It's different. It's S-E-E, not S-E-A. So you see the food and you want to eat it. And then when we are giving them this hormone, which is the GLP-1 most of the time, and we like to give a GLP-1 and GIP, but most insurance don't cover the Mounjaro, we will restore their eating for hunger, we restore their satiety, we stop the food reward for eating when we are stressed, when we are bored, when we are upset, and when we see the food. And the medications for weight loss, early stage, like one of the old ones, we rarely use it. It causes a lot of GI issue. We use the glucagon-like peptide I just told you about, and those were approved for diabetes before they were approved for the weight loss. So it comes in the form of Ozempic, or Wegovy, or Victoza, or Saxenda. So when we are approaching the healthcare about the diet, and a lot of people would ask me, what kind of diet do you recommend? I recommend your own diet. Whatever you want to eat, just eat, but eat enough to how much your body can burn. Because you put people on a low carb diet, you put them on South Beach diet, you put them on this diet, they will do it. They will do it, and they will stay on it for a few months. The minute they stop, they go back to where they were. So I take whatever they do and let them follow their sense of hunger. And usually when they are having those missing hormone in their body, we make them divide their food in two parts. They eat part A and have a glass of water, give enough time for the medicine, which we just gave, to kick in. And then if they are still hungry, then let them be. If not, most of the time they stop eating. And you don't have to get from your body mass index of 35 to 25 to get the benefit. Every little changes will make a huge difference. So even 5 to 10% weight loss will have significant reduction in diabetes, in heart disease, improving the lipid profile, the blood pressure, and the sleep disturbance. So, how do they start? Like, what do they do? Should I do paleo? Should I do Cambridge, South Beach? You do whatever you're comfortable with. I never ever force any diet on anybody. I just want you to do what you are comfortable with and then cut it down in half. And activity, it's very important to find something you like to do. So one of my patients, she was losing a lot of weight, and then I said, what kind of exercise? She goes, I have a glass of wine, and I put the music so loud, and I dance for 2 hours every day. I said, that's a great idea. So that's treatment for depression, for obesity, and for the mind. So it's really find what you like. So you don't have to get to the health club. You don't have to go on the treadmill. And there's so many video clips. You can do anything in your comfort zone at home. And I am a big advocate of dancing. So today I made you all do this. So this is a small tool we use to identify how many calories you should consume to lose weight. You will be surprised. Again, for like 27 years, I've been doing this. So the key is finding the missing hormone, and the other one is finding how many calories your body can take. So we have one of our volunteers. She gave us her scale, which I'm gonna go over this with all of you. All of you here today get this or will get this, the one who has not gotten it yet. So it's 4 pages, and this apparatus has been used for NASA. It's the company called Velala Scientific, and what they do was, you notice, you put your hands and your feet on the plate, and there's an ultrasound goes through your body, and it analyzes the body, depends on the fat distribution. So if the fat is here or in the thigh or in other part of the body, it will give me clear idea how many calories you should consume. So this young lady, unfortunately, she can consume 1,100 calories to maintain her body. So as you can see at the bottom, body mass index 28.6. It's slightly overweight, and her body mass index, although it's in the overweight, she can only consume 800 calories to lose weight. So it's 1199, as you can see, the basal metabolic rate, 1199 to maintain the body mass index of 28, which is slightly overweight, but we minus 200, 300, 400, 500, depends how much they want to lose. So she can only consume 800 calories. And this is really hard, but this is the tools. And when people stick with it, it does work. And then there's another page. So the top page gives me the exact weight. The second part, total fat, 32.3%. And then the visceral fat, which is the fat right in the mid part. And this is a very bad part of our fat. That's independent risk factor for heart disease. And then there's the water amount, and there's the muscle, and body mass index 28.6, and the calories, how many calories they can consume to lose weight. So you're all gonna get a copy of this. And sorry. So this is page, oops, I lost it.